Okay, healthcare has been at the forefront of our lives these last 20 months. Next, we have Dr. Nasim Afsar, the Chief Operating Officer at UCI Health, who will talk about healthcare in the supply chain.
Good morning, everyone. Thank you for giving me the opportunity to talk to you all about our healthcare supply chain at time of crisis. What I would like to do is to talk about some of the challenges that are specific to healthcare supply chain, and then what we did to be able to address those, and some considerations for the future. There we go. All right, so let's step back and just look at kind of what the pre-COVID philosophy was in healthcare. Very similar to other industries, healthcare had really moved into a just-in-time inventory philosophy. And what that had created is a significant reduction in storage of inventory. For us, we went from 80,000 square feet of storage to 10,000 square feet of storage, which significantly reduced kind of our inventory on hand. Now there are a couple of issues that particularly came into play for healthcare when COVID hit. The first one was that if you look at kind of some issues specific to healthcare, we deal with regulatory recommendations at times of pandemic that really change quite rapidly. So the CDC recommends a particular set of protective gear. We go out, we purchase this, and those recommendations can change. And we are now kind of stuck with inventory that we can't do anything about. I think on top of the regulatory recommendations is quite challenging, particularly when some of what we would really like to be able to use and leverage at the time of the pandemic are not readily available. When it came to particular things, for example, like N95, it was interesting to see that we had a workforce of several thousand people who were fitted for their N95. There was one or two types of N95s that they were fitted for. And with the pandemic and the supply chain issues, we didn't have access to those N95s. And so we had to refit thousands of people for what we were able to have access to. So again, the regulatory recommendations are something that are very much front and center in how we have to manage our supply chain. Another issue specific to healthcare is overall the lack of manufacturing capabilities that really lead to heavy reliance on external vendors. And again, looking at that across the board in various industries, I think this is not unique to healthcare. I think the part that's unique to healthcare is that the supplies that we are looking for are really life-saving for our day-to-day care of our patients. And so really that lack of manufacturing capabilities creates significant challenges as we're trying to care for our patients during the time of the pandemic. Also in healthcare, expiration dates on our supplies really limit our ability to use existing inventory. We have a significant amount of inventory that is subject to expiration dates, and we are heavily regulated, so we again stay very much on top of those. However, that's inventory that could be leveraged that has to go to waste at a time of short supply. As a tertiary academic medical center, we have a lot of unique specialty preferences and not a whole lot of substitutions. So for example, for a neurosurgeon or a cardiovascular surgeon, there are particular supplies that they use for their surgical procedures that is based on decades of training, and it's not easy to be able to substitute that when we don't have that that supply in stock or don't have the ability to get it. So, and again, I think that the more tertiary, quaternary, or specialized the healthcare delivery system is, the more challenging it is to be able to find substitutions. We, like other industries, rely heavily on group purchasing organizations that really dominate our sourcing. And at a time of the pandemic, again, this really could limit the options to be able to get access to what we need. So what's the impact of all of these limitations during time of crisis, as we saw with the COVID-19 pandemic? We all saw newspaper headlines similar to this that was published in April of 2020. In Time, we saw healthcare workers in trash bags and people fashioning all types of different things to try to have safe protective equipment for patient care, which was really quite unfortunate. How did we solve this supply chain problem as we were working through the pandemic? You know, I think that the theme of this conference is very near and dear to my heart. I think Reimagine, Reinvent, and Resilient are really the pathways that we leverage to work through the challenges that really impacted the day-to-day lives and health of our patients, our coworkers throughout UCI Health. Looking at how we reimagined how we can move forward, we began to really partner in novel ways with our providers to evaluate what can we potentially change to clinical practice in terms of the alternative options that we had. And again, these are conversations that we've never had to have in the past because we have had access to supplies, but it really kind of led to some novel conversations around our existing practices. Are there better, more robust ways to be able to look for the supplies that are necessary for particular surgical cases? And what can we do to ensure that we continue to care for our patients during this time? I am thrilled to say that through robust management of our supply chain and conversations and partnerships with our providers, that we had zero disruptions in our ability to be able to provide safe and high quality care for our patients. We also had to work with governmental agencies and internal regulatory teams to really look at those expiration dates on some of the supplies to see if there were opportunities with some of what we used, again, which is highly regulated and we have to comply with the regulations, to see if we had leeway to be able to leverage and use those supplies beyond the expiration date, which gave us a little bit of give in the system. Looking at Reinvent, we looked at how can we identify opportunities for internal and local manufacturing. We were thrilled that in April of 2020, just at the height of the first wave of the COVID-19 pandemic, UCI Beale Applied Innovation Center, along with UCI Health School of Nursing and School of Engineering, really came together to construct over 20,000 face shields for our healthcare workers, which was really instrumental again in those initial months as we were trying to make sure that we had appropriate PPE for everyone. We also talked to local businesses that had manufacturing capabilities to see what are elements of what we need to be able to provide the supplies that are necessary for frontline healthcare providers. We also really learned to leverage our talent to rethink the challenges ahead of us, things that, again, we had not thought about before. We were on a multidisciplinary COVID-19 call, again, in the early days, and found out through these conversations that we were going to have a shortage in the viral media that is used to be able to detect COVID-19 or to detect the coronavirus. virus due to shortages from vendors, our researchers jumped right in there. They found a recipe to be able to make this media on FEMA's website. Open Biolabs got researchers to jump in there and make the viral media, which was absolutely instrumental to our ability to make sure that we could test without disruption. And I think it really showed us our interconnectedness with our larger community, and the fact that people wanted to help, and we just had to kind of think more broadly and think outside the box to be able to identify those opportunities. Looking at becoming more resilient, again, acknowledging the weaknesses in our supply chain and creating early warning signs. I think Nikhil really highlighted this well in his remarks with, in addition to the pandemic, there's geopolitical instability, there's climate change. We had not thought through previously about all those weak links within our system, and being thoughtful about what are alternatives, really thinking through those in a proactive fashion rather than a reactive fashion. So again, being a lot more in tune with what's going on at a global scale, and then proactively really planning for how do we address or deal with some of these challenges that are going to come up. The GPOs also were incredibly helpful in kind of redefining our relationship in terms of what were the areas where they could leverage their purchasing power on our behalf. It meant at times going outside of the vendors and groups that we all were used to, and were working with to really think much more broadly around how we can leverage the power of the GPOs, but in different ways than we had in the past, and really kind of building new partnerships with the GPOs to be able to get the supplies that were critical for patient care. I think as we think through about the future of supply chain and healthcare, there's a couple of things I wanted to highlight. One is, again, the need to really develop and attract talent in the space. This is an area where we have some major fundamental issues in being able to ensure resiliency of our supply chains, and really being able to both develop and attract talent that's going to think through these challenges and opportunities in the years to come is really critical. Focusing on our workforce, again, everything from ports to truck drivers, the issues that we are dealing with, and ensuring that we have a resilient workforce, one that is able to be able to deliver what we need in a timely manner, again, becomes really critical. And I think that's something that at a larger scale we all have to think through and work through. And then again, another point that was brought up earlier, again, how do we modernize our supply chain operations? Unfortunately, there's a significant amount of what goes on that's still quite manual, that technologies like AI, blockchain, that can really help do more proactive and predictive analytics are not in place. And so really looking at building a more reliable and safer system through modernization is really going to be key as we move forward. And then lastly, really, what's that balance of globalization with localization and domestic capabilities? I think what the pandemic showed us is that we are all interconnected. We have some local capabilities that we were not aware of or did not think about in the past. As we move forward, having more geographic diversification with where our supply chain comes from, especially in matters that are literally life and death, to make sure that those supply chains are more resilient and reliable, and finding a better balance than what we had pre-pandemic. Thank you so much for the opportunity to talk to you all. I have listed my contact information there, as well as the contact information for Susanna Rustad, our Chief Procurement Officer, who really did a phenomenal job throughout the pandemic, ensuring that our frontline healthcare workers stayed safe and our patients receive the high quality care that they deserve. Thank you all.